RSV is a common virus that can affect the nose, the throat, and lungs, and symptoms can be mild for most adults, but it can be dangerous for infants and small children, often leading to hospitalization. Shared Health wants parents to know about some changes to infant immunizations. Joining us now are fourth-year pediatric residents Meredith, Chiu, and Falla. Good morning to both of you.
Good morning. Good morning.
Thank you so much for joining us. Now, if people don't realize what RSV is exactly, what is it and why is it so dangerous for little ones?
Yeah, so RSV is a very common virus that typically starts to really pick up in the winter months.
Okay.
As a virus, it's not something we can cure with a medication or antibiotics. And for the common adult or healthy older child, it's just a common cold. Mm-hmm. But for really young children, especially less than 6 months or those with medical conditions, it's one of the most common reasons why kids need to get admitted to hospital.
And they're not necessarily always just infants. It could also be toddlers that really can get affected by this.
Yes, but typically when they're a toddler size, they're not really as sick as needing to come into the hospital. They might, but most commonly it's for the younger children.
And why is it so dangerous? It really blocks their airways, right?
Yeah, because babies have smaller airways than older people. Okay. A little bit of mucus can plug up the airways and just make them have a really hard time breathing.
Oh my gosh.
Compared to bigger people.
Okay, so there are new rules when it comes to immunization. Before we get to the new rules, what were they before?
So it used to be that we had a small RSV. We say vaccine, but it isn't really a vaccine. Okay. It's an antibody that instead of your body producing its own antibodies, like your typical vaccine, this one, the body's given the antibody to help your own immune system fight off infection. So it skips that kind of step of a vaccine needing to boost your own immune system.
Okay.
It used to be that only high-risk infants, so those with other medical conditions, would get the product, and they needed to get it every 4 weeks.
Okay.
There's now a newer product that lasts longer, really for the whole RSV season. And new is Shared Health and Public Health and the government has been able to get access for this product for all healthy infants who are born within the season.
Okay, so I mean, Katie, you're expecting a baby in just a few weeks. What does this mean to you as an expecting mom, knowing that this is available now to your child? Because you've seen the worst of the worst.
Yeah, so it gives me the peace of mind. I've seen children coming into the emergency department, needing to be admitted to hospital, and sometimes going to intensive care because they're so sick from RSV. And we know from previous jurisdictions that have introduced the new product that this reduces hospitalizations significantly, somewhere between 70 and 90%.
Wow.
Yeah.
And so basically the child is able to get this antiviral right at birth, pretty much.
Yeah, so the easiest way to get it is before you leave the hospital. Most birthing centers and hospitals will have it available, and it's safe to get as soon as you're born. So it's the easiest way to make sure that your baby who's eligible is getting it. But if you've missed the dose and you declined it in hospital, there's ways in other clinics that public health can help arrange for them to still get it if they're eligible.
What messaging do you have to parents, especially those that might be expecting a baby in the near future? What would you tell them to sort of put their fears to rest when it comes to this?
Yeah, I think we know from where this product has been used before that it is safe. Mm-hmm. Like we said, it's not a vaccine, but it gives the antibodies that our bodies have all produced in response to this virus, but that babies haven't had the chance to yet. And it protects the most vulnerable patients, which are the young babies and younger children with other health conditions.
So this is good news for you, being in the healthcare industry.
It's great. It's also great for families. No one wants their child to get admitted to hospital. And healthy children who've never been sick, you don't expect them to need to be in hospital.
Right.
So it's really wonderful that we're able to offer this to try to keep kids from needing to get admitted.
Okay, and it's good for 5 months, so then they'd have to do it again, right?
So right now it's only for this first season.
Okay.
And you don't really need a repeat for otherwise healthy children, because the thought is you're not the high risk group anymore.
That is incredible. All right, well, thank you for this information.